Thousands of children in Kenya are either born with deformities or later develop disabilities. Oftentimes, they are neglected and abandoned by their families because of the stigma associated with having such a child. In the past, Kenyan media has reported cases of deformed children being chained indoor in order to avoid parental shame and ridicule from the public. In the end, these children not only suffer as a result of their disabilities, but also become socially segregated. Rarely are these children taken for assessment to the few health facilities that are available. Potential surgical correction thus seldom occurs. Consequently, their conditions often worsen and may develop further complications, or they may die an early death. Most African communities believe that children born with congenital deformities are a curse and nothing much can be done to improve their situation. Those who believe and are aware that something can be done often cannot access the services of the few medical specialists in Kenya.
We've learned that many of the children, not only with hydrocephalus and spina bifida, but with other disabilities, are referred to as cursed. They're shunned from society. In a manner of speaking, they are a bit like of an untouchable person. Their parents are a little bit of an untouchable type too, because they are recognized as bringing an abnormal being into the society. Many times the villages as well as the country shuns these people, and we're trying to make a change in this by giving value to their lives. Many of these mothers come to us with their disabled child and they don't even have one shilling, one penny to help us with the bill, but we encourage them, please keep coming, come early. And God has never let us turn away a child because of lack of money.
Bethany Kids at Kijabe Hospital is a very unique facility for the African continent. It is dedicated to the care of children with congenital and acquired deformities, and particularly those with hydrocephalus and spina bifida. The facility cares for disabled children in Kenya as well as neighboring countries, including the war-torn Somalia and southern Sudan. It serves all the 8 provinces of Kenya with a network of 15 mobile clinics spread through the country. Disabled patients are evaluated and, if appropriate, scheduled for surgical rehabilitation at Bethany Kids. The lives of these children across Kenya and neighboring countries have been transformed as a result of the ministry of Bethany Kids and the former Bethany Crippled Children's Center. Some of them are currently studying in local universities and others are working successfully. Jane Kimani, a former student of Joytown Special School in Thika and currently a staff member at Bethany Kids, was a former patient of Dr. Bransford in Kijabe.
I work for Bethany Kids as an administrative assistant. I met Dr. Bransford in 1990. I was then a student at Joytown Primary School.
She attributes part of her success in life to the care she has received at Kijabe through the help of Dr. Richard Bransford. Billy Nganga, a computer science student at Kenya College of Accountancy in Nairobi, remembers his difficult childhood and the complications he suffered as a result of spina bifida.
I started my education way back in 1990. That's from nursery school. And I found it a bit difficult because I have a condition known as spinal bifida. That is, I'm not able to control my bladder. I went through several operations to correct several deformities, and they've all been done in Bethany. In Bethany, that is where I got to meet people that had my problem, and we could also share, because I believe from sharing, that is when you get to know more about yourself.
Rebecca Opetsi, a former patient of Bethany Kids and a student of Strathmore University, expresses her gratitude for the care she received through the ministry of Bethany Kids.
I was born in 1987, and I was born with spina bifida. Throughout my life, I had so many difficulties because I never knew what was spina bifida. After realizing where Bethany Kids was, I went there, got some counseling, and they introduced me to CAC and things like oxybutynin. And after using them, now I'm living a much better life.
These are just a few examples of young people whose lives have been changed through your prayers and support. They consider Bethany Kids an instrument that God has used to bring hope and success in their lives. A growing number of children with disabilities continue to come.
Every year that I've worked at Bethany Kids, we have experienced growth. But somehow this past year, this growth has been overwhelming. We have tried to maximize our bed space, our efficiency in surgery, every minute and hour of operating time. And yet still, we have more than 200 children that are on our waiting list, waiting for their surgeries to be done. But more importantly, waiting for healing and for hope, which we trust and pray that we will be able to bring to them with your help.
You can help alleviate their problems by supporting their care through the ministry of Bethany Kids.